As the holiday travel season approaches, there's a danger airline passengers should be aware of. Cabin air can get contaminated and make you very sick.
Susie Steimle first reported on this problem earlier this year and joins us now with the latest. Susie?
Well, Ken and Liz, we discovered a flawed design in almost all airplanes can cause toxic fumes to enter the cabin. And our investigation revealed that the industry and regulatory agencies have missed several opportunities to protect both their employees and the public.
It's affected my entire life, my kids' lives, my whole family, my husband. It's a huge medical nightmare.
Terry Williams has been sick for 11 years from a toxic exposure that few people know exists. The former flight attendant says it happened when her American Airlines plane was getting ready for takeoff from Memphis, Tennessee, one April day in 2007.
We were taxiing and there was smoke in the cabin visually, and notified the cockpit, and the smoke dissipated quickly. But that evening I thought maybe I was getting sick.
She says at first a cough and headache went away, but then the headache came back with a vengeance, along with some other strange symptoms: numbness, tremors, memory lapses.
The doctors were treating the symptoms, but more and more symptoms continued to happen.
It took months to make the connection. Turns out the smoke she breathed in the cabin that day contained tricresyl phosphate, or TCP, a chemical known to cause serious neurological and lung damage. The fumes come from oil in the engine. Nearly all commercial jets bleed fresh air in from the engines. That air is then fed through an air conditioner into the plane. If an engine seal fails, toxic particles can get into the cabin. It's described as a dirty sock smell. With very few exceptions, commercial airlines don't have the ability to filter out toxic fumes, even though hundreds of people, including passengers, have been sickened by them. In fact, most airlines don't even have a basic carbon monoxide detector on the plane, and carbon monoxide is the best indicator that there are toxins in the air.
It doesn't make sense to design a system where you're bleeding or extracting outside air off an engine that sometimes leaks oil without putting a filter in between the engine and the people. I mean, that just doesn't make sense.
Judith Anderson is the air safety, health, and security expert at the Association of Flight Attendants. She says the industry has known about the danger for decades. In 2008, her union took part in an FAA-funded study called for by Congress. The researchers' plan was to distribute this small handheld sampler, the size of a soda can, to flight attendants so that they could capture the chemicals in the air during a fume event. The air sample could later be tested in a lab for toxins to quantify potential exposures and help prevent them. But she says
the airlines systematically said, no, you cannot carry those samplers on board.
As a result, to this day, there's no way to measure exposure when it happens, but traces of TCP can be left behind. Using a kit from a lab, we decided to find out how much. On 4 different flights, we swabbed the cabin wall for traces of the toxic chemical. We're not identifying the plane or the airline because fume events can happen on almost all of them. And now we're sending it off to ALS Environmental Laboratories in Salt Lake City, Utah. One of the samples came back positive. Not enough to make you sick, but a confirmation that fume events are happening. This was a tiny sample. Consider that we only swabbed 4 flights out of 87,000 that crisscross the country daily. In a statement, the FAA told us studies have shown cabin air is as good or better than the air found in offices and homes.
The FAA has its head in the sand.
Alyssa Brodkowitz represented Terry Williams in a lawsuit against Boeing. She believes the danger is purposefully being buried because the industry doesn't want passengers to know.
This is aviation's dirty little secret.
We obtained a document that appears to support that. It's a fume event checklist allegedly distributed by an airline company to employees just a few months ago. Item number 12 clearly spells it out. Do not make a PA. That's a public announcement regarding the substance. Terry says that continued secrecy is making her want to speak out again after all these years.
Just to let people know that there is a risk when you get on an airplane, that it could be you. it could happen to you.
One of our sources for this story is a doctor at UCSF. He personally has seen more than 100 patients in the Bay Area who've been sickened by toxic cabin air.
Wow. You know, I think when you get on one of these things, you can smell.
You know, so funny smells on planes all the time. Nobody
Right.
knew they were toxic, though.
Right. I mean, it's just one of those things that not a lot of people know exists, and they're happening quite frequently. Actually, the most recent study on cabin air contamination found that it happens roughly 16 times a day in the United States, but it's underreported by the FAA, and that's because reporting is only required if the airline determines the fume event is linked to a, quote, aircraft component. And very often, of course, the airlines will say themselves that it's not.
And we got to get going or we're going to be late, blah,
Right.
blah, blah.
Exactly.
And there's an assumption, too, when you get on an airplane, it's sort of a sterile environment. Everything's been clean, but not necessarily.